Researchers in Singapore have come up with a non-invasive imaging technique that can identify patients who suffer from a curable form of high blood pressure or hypertension. The procedure, the first of its kind in Asia, is undergoing clinical trials. It was announced on the sidelines of a healthcare innovation summit today, and Tan Si-Hui reports.
Do you have any family members?
42-year-old Lim In Chong has been suffering from high blood pressure for over 20 years. No one could really identify what was the cause until he underwent this scan called the 11C metomidate PET-CT. It found an excess of hormones in his kidneys.
I'm glad that finally they have discovered the cause. This one is painless and it's quite quick, within an hour. And you don't have to stay inside the hospital as well.
He actually went through the procedure and it found the problem on the right side. So after a very long journey, we certainly hope that we can actually send him for a curative surgery.
1 in 4 adults in Singapore suffer from high blood pressure, and researchers say about 5% of patients may have a potentially curable form of the condition, similar to Mr. Lim's. The imaging technique has been performed on over 20 patients, though it's still under clinical trials.
Hopefully the evidence would be strong enough. It would move the policy makers, for example, to think about how to assess the cost benefit and so on. So all of these things need to come into the factor to decide how soon we can get this into the clinical practice.
The new technique was showcased on the sidelines of the National University Health System's first Innovation Summit. About 60 clinical trials like this are approved in National University Hospital each year. Speaking at the summit, Deputy Prime Minister Heng Swee Keat said there's a need to transform the healthcare sector through research and innovation.
As academics and healthcare professionals, you drive the next lap of advancements of our healthcare system. Your innovations will help promote good health, develop new breakthroughs, and shape healthcare policies.
Mr. Heng said that to translate research breakthroughs into cost-effective intervention, there is a need to widen the talent pool. So today he announced the establishment of the Brenner Fellowship.
Under the program, Singapore-based undergraduates who are keen to pursue research in biomedical science will be able to work with mentors overseas. It was named after the late Dr. Sidney Brenner, a world-renowned scientist. But researchers say more needs to be done.
Some of the important healthcare challenges is really dealing with an aging population, the increasingly complexity of healthcare problems that relate not just to the medical issue but also to social, economic issues that require really team-based approach, multidisciplinary approach.
He says funding will be key to driving innovations to solve these challenges.